I'm Kimberly Abbott. I'm the Vice President of Communications for World Learning. World Learning is an NGO working in more than 60 countries to empower people, communities, and institutions to create a more peaceful world through education, exchange, and development. And I'm so pleased today to welcome Charity Wallace. She is the Vice President for Global Women's Initiatives at the George W. Bush Presidential Center, and she is the Senior Advisor to Mrs. Laura Bush. She is charged with setting the vision and engaging policy on women's issues for the center. And that includes the Pink Ribbon, Red Ribbon campaign for global health, empowering women in the Middle East, and engaging first ladies around the world. She worked in both terms of the Bush administration and traveled to more than 65 countries around the world during her tenure there. So welcome, Charity.
Thank you.
Mrs. Laura Bush chose educating women and children as her signature issue and used her platform throughout her tenure, and since leaving has really scaled that globally. Can you tell me about what she's been doing since leaving office?
Sure, absolutely. So as all of you know, Mrs. Bush was a teacher and librarian by education, and so when she was thinking about how to use her platform as the First Lady, she obviously went to what she knew best, which was education. And then, of course, after September 11th, all of our eyes turned towards Afghanistan. And so really her platform opened up within a few months of them being in the White House to continue to focus on education, but it was more of a global focus on women's empowerment. And so as we've come down, she says that after leaving the White House, she traveled to 75 countries when she was the First Lady and really used that platform in all 50 states to use that platform to promote education for women and girls, because we know from research the impact of that. And then we also know what it does for economic opportunity. When women are included in the economy, countries are more stable and prosperous. We know that when women are healthy, their children are going to be healthier. And if they live, and this is a sad fact, but if a woman dies before her child reaches the age of 5, that child is 10 times less likely to survive. So we want to ensure that women are healthy. So we work on all of those issues at the Bush Institute. Mrs. Bush says that when she went back to Dallas that she's living what she calls the afterlife, and President Bush calls it in the promised land. So they love being back in Texas, but they wanted to still be involved in policy. So we created the Global Women's Initiatives. There are 4 programs within that. As you described, we have a Pink Ribbon, Red Ribbon initiative, which is our cervical and breast cancer initiative that addresses cervical and breast cancer in 5 sub-Saharan African countries, building on the PEPFAR platform. So leveraging the HIV platform to then expand services to address cervical and breast cancer. And then our Women's Initiative Fellowship. President and Mrs. Bush feel very strongly that women will be integral to leading the peace and democracy movement in the Middle East. So we have fellowship classes from Egypt and Tunisia for leadership development for women to help build civil society and a strong network among women. And then Afghan Women's Project, she continues to work on Afghan issues, promoting education, economic opportunity, and health, and really working as a founding co-chair of the U.S. Afghan Women's Council, which was started in 2002 and still is part of the State Department today. And then, of course, our First Ladies Initiative. And having been a First Lady and used her platform effectively, she knows what it takes, and also the use of that podium and platform and the difference that it can make. We've seen from the United States how First Ladies have used their podium so effectively. And so in 2013, we hosted a First Ladies Initiative in Tanzania. And it was a summit that we hosted. Mrs. Obama came to that, and they had a conversation, the 2 of them, and then we co-hosted an event last summer with the White House again for First Ladies to talk to them about how do you leverage your platform effectively, how do you create public-private partnerships that move the needle for issues that address women and girls.
And it's interesting, you were saying that some of these First Ladies don't know. They have this platform, yet they're seeking advice from you on what subjects to use, and then how they engage their staffs, other ministers, the ministers of health and education, how they create the holistic approach. So what are you telling them? What is your best advice to them?
So it was interesting, at that 2013 summit, the Ethiopian First Lady was relatively new to her position, and they had a private roundtable with just the First Ladies and Mrs. Bush and Cherie Blair, and she just raised her hand and said, I never anticipated I'd be the First Lady, and I don't know where to start. And so their advice was start with what she knew, her expertise. And then there would be other things that came along the way. And so since that time, she actually launched 3 incredible programs on education. one on developing markets for economic growth for women, and then also Pink Ribbon, Red Ribbon is in Ethiopia is one of our countries. But really taking that platform and leveraging it, thinking about how do you work with the ministers of education or health, as well as corporations and NGOs that are working on the ground to address holistic issues. And so last year we got to go to Uganda and sit with the First Lady, and she said, I want to develop a holistic agriculture program. So our team put together a list of 15 different organizations that were working on the ground. That was a continuum of service, from everything for the loans that the female farmers would need to buy the seeds, to the people who do the seeds, to the people who do irrigation, and then taking it all the way to taking it to market. So we brought all those individuals and corporations and foundations together with the First Lady, and she said, I've never met any of these individuals, so they've developed this partnership, this public-private partnership now to create a holistic approach.
So since you mentioned public-private partnerships, let's talk about what works. These days, corporations don't just want to throw money at a problem, they want to be involved in the solution. So tell me about some of the best partnerships that you've been involved in, both when you were in office and now. What works and what should advocates think about when they're trying to engage corporations?
Well, that's one of the things we do in advisors training with some of our First Ladies, chiefs of staff and other advisors, and have the corporations come and talk about how do you become a good partner. One of the things corporations say is we don't want to just give you money, we want to be part of the, like you said, part of the solution. So some of it's research. So we're doing a big research project on the effectiveness of First Ladies. There's almost no research on First Ladies and what are the levers that they can pull. So ICRW is doing that. It's sponsored by ExxonMobil. So we're working with them to really identify what makes an effective First Lady, what are the levers they can pull. But also then thinking about what do you bring to the table. So corporations, it's important for NGOs to be transparent, to be above board. There's all these, to be trusted on the ground. Most of them know better what's going on the ground than anyone else, better than a government, better than a corporation. So they're the trusted partners on the ground. So they bring so many assets to this partnership. But they also, I think, one of the things that I think about when we're going to meetings is to listen as much as we talk. So listen to the needs of the corporation, of the First Lady, of the NGO, and then identify ways in which you can collaborate together. So actually, Malaria No More is a great example. We just celebrated Malaria Day on the 25th, and they brought corporations, the government, and foundations all together to address malaria, and it's gone down so much within the last 10 years since it was launched. Or PEPFAR is another great example of a public-private partnership that's worked very effectively on the ground.
Let's bring it back here for a minute. What is your best advice for advocates? We've heard so many inspiring stories today. We heard the young woman from Bolivia who said she went back to her country to just raise a fuss. How do you raise a fuss here? What's the best way to make sure that your issue is at the top of the agenda?
I think there's so many NGOs and so many organizations working on great issues for women. So that's the good news, is that there's a lot of us working in this space to advance women and girls. I do think, though, it is identifying ways in which you can aid or advance a particular policy issue that's important, or how you can coalesce together, build coalitions around a particular thing. So this holistic approach is really important. Look for other organizations that are in this space that are maybe doing something slightly different than you, but that you all can come together to present an idea, either to a corporation or to a policymaker. And again, I think it's really about listening in meetings as much as you're talking, and then thinking about how do you develop a mutually beneficial approach.
So give me an example of something that really worked when you were working with the First Lady in the office.
Well, we did a lot. I mean, Malaria No More is actually a really good example, I think. We talked about the fact that malaria is one of the #1 killers of children, and employment was really hard. So there's corporations that care because their employees get so sick they can't come to work. So they need a workforce that's going to be coming every day. And so reducing malaria was an enormous benefit for them from a financial perspective. So that's why they were initially interested. Then we have the groups like the government, who is going to come in, working with our government, worked with the governments in these various countries. So they then, there was leadership from the ground that was very critical. And then there's all these great, like the MBA is part of it. So there's advocates who have large platforms to voice and to talk about it, which is really important, I think, when you're trying to get your word out, is how do you use your podium or your platform. But I think that's a great example of what we've done. And like I said, within the last 10 years, malaria has gone down so significantly because people know about it, because there's nets that are available, because there's spraying, and there's education that's around it. So it's raising awareness, it's the practical application, and then it's working with the leaders in the government.
Okay, so building coalitions as well, listening to what the government officials want out of this, and making sure that it's a two-way street.
That's right.
Okay. Let's project a little bit and tell us how you've seen these issues evolve since you've been watching from afar, and what you expect to see in a Clinton administration or a Bush administration or a Rubio administration. How do you think the issues of women and girls' education and access to health care will evolve going forward?
Well, I think, it's interesting to think 20 years ago when Hillary Clinton, we were talking about Beijing, and how she said women's rights are human rights, and how that was such an enormous statement at the time. And like Terry said earlier, now it's just, it's sort of course, that's what it is. So I feel like in the last 20 years, we've come so far with women's rights, quite frankly, in every area.
Not there yet.
Not there yet, no, but we're on our way. And so it's amazing to think about what the US government and all of you all, NGOs, foundations, corporations are doing. It's in the vernacular of everything. Every day you pick up the paper and it's something that we read about. So we've come a huge way, I think. But obviously there's more to be done. And so if we're going to continue, I think any administration will continue working on these issues. The Global Women's initiative at the State Department was a great stance. We had that under the Bush administration. We didn't call it that. And so it was smart for them to make it a Global Women's Issues Office, because it's important and it needs to be raised to that level. So I think any administration, whether it be Clinton, Bush, or Rubio, or whoever, they'll continue to elevate the issue. But it's critical for our economic stability, peace in the world, and education for girls, health. It's such a holistic approach. I think
everybody can agree.
Yeah, exactly. That's right.
I'd love to hear a couple of your best stories. I know you talked about cervical cancer and implementing that in rural areas, and how the platform of the First Lady was able to expand that exponentially. Tell me those stories that have really kept you on these issues, because they are so inspirational.
So we launched Pink Ribbon, Red Ribbon in Tanzania at the summit in 2013. And then the First Lady became the champion and advocate for that. So last International Women's Day, she went to a region in Tanzania to raise awareness about it. It's very taboo. The topic of cancer still is very taboo, particularly cervical cancer.
Second leading cause of death for women there.
Mm-hmm. And in some countries, it's the leading cause of death. And it's interesting, maternal death has gone down, but cervical cancer has actually surpassed the amount of women dying from cervical cancer than from maternal death. And it's women who are 19, 20, very young. It's very easy to screen and treat, very inexpensive as well. So she went to this region to talk about it. People found out that the First Lady was coming. They didn't necessarily know what she was coming to speak about, but all these women wanted to come hear her speak. So she talked about the need to go get tested and to destigmatize the issue of cancer. The Kikwetes, Mrs. Kikwete, when we launched PEPFAR in Tanzania, the President and First Lady got tested for AIDS on television. And it sent a huge message to everyone to go get tested. So she used her platform again to do this for cervical cancer and breast cancer. And they expected 2 days, maybe 2,000 women to get screened. It ended up being almost 10,000 women that got screened over, and they had to extend it for a week. And it was about her leveraging her own platform and speaking to them from a woman's point of view, too. I think really identifying with them personally to say, this is something important. Don't brush it under the table. Don't let your daughters do that too. Make sure that your daughters, yourselves, your mothers are all getting tested. And again, it's life-saving, and it's very inexpensive and easy to screen and treat. And so it's destigmatizing it and again, using her platform, which is really great to see, and to think about how that can be multiplied throughout the world by not only First Ladies, but obviously all of us as advocates.
Great. Thank you very much.